Well, who doesn't want to go to Goa? I think during the course of this pandemic, all of us have thought about heading back to one of the most popular holiday destinations in the country. But what's really the COVID situation in Goa? We have Vishwajit Rane. He's joining us on the broadcast. He's the State Health Minister. Appreciate you, Mr. Rane, for taking out the time. As per the official figures, there are just over 1,900 cases in Goa. Bring our viewers up to speed. What's the current COVID-19 situation in Goa?
Yeah. What is the switch on the camera?
All right, we're going to fix that glitch in a moment. Mr. Rane, can you hear me?
Yeah, I can hear you.
All right, appreciate you being with us. I wanted to begin by asking you, there are several people who are, of course, considering, taking a break, heading to Goa. Goa selectively opened up registered hotels. With just over 1,900 cases at the moment, what's the current COVID-19 situation in Goa?
Ishita, at the moment, Goa is slowly opening up as far as the tourism sector is concerned. And as we speak, the number of active cases in Goa are about approximately 830 active cases, and the number of recovered cases in Goa has been about 1,201. And we have had about 8 deaths, but the recovery rate in Goa is one of the highest. We can consider it one of the highest in the country. And also, as far as Goa is concerned, the total number of positive cases that we had till date was about 2,039 from the first case. And the situation here is that the SOPs and the standard operating procedures that we have been following, and Goa is the only state where the testing is one of the highest that we are doing in the country. And also people who enter the state of Goa, we have been insisting on the COVID negative certificate. Otherwise, we are asking people to take a test and accordingly quarantine themselves till the time the results come.
Right.
And we are going to increase our testing capacity and capabilities by introducing the nasal swab, which has been approved by the ICMR. So this is the situation as far as Goa is concerned. I still feel that the situation, a lot of patients that we have got, which we have detected, are all asymptomatic. There are very few patients who are symptomatic and who are in the COVID hospital.
Right.
But overall, the situation in Goa is pretty safe.
All right, the overall situation in Goa is pretty safe, and we'll come down to discussing what tourists who want to visit Goa need to know specifically. But the other important thing that you've done, Minister, is ask the ICMR for a nod to set up a plasma bank in Goa, and you're doing this, despite the fact that you have just about 2,000 cases, and you're saying currently only about 800 active cases.
Ishita, the basic thing behind starting of the plasma bank, today we had a detailed discussion with the Chief Minister, and I've been pushing for a plasma bank in the state of Goa. For having a plasma bank, I do not require the ICMR's permission, since we have already got a registered blood bank and with all formalities completed. So we have already procured all the apheresis machine and whatever is required, to draw the plasma. And also, we are trying to encourage people to come and donate the plasma, the COVID patients that have recovered, and also after the protocol that needs to be followed in this case. The reason is that every life matters. In Goa today, we have had 8 deaths, and that is about 0.05% overall in comparatively to the number of cases that we have in the state of Goa. But for us, since every life matters,
absolutely,
we have a capacity to store about 4,000 packs of plasma. We are going to now target initially the people that have been registering to come forward, and we are trying to promote this so that, in case of serious patients, we are in a position to use this therapy, and we are trying to see that how best we can use it to save people's lives. I'm in constant touch with my counterpart and our senior health minister in Kerala, and the protocols they are following, and the protocols that are generally laid down by ICMR. So basically, we are trying to do this on the compassionate use of convalescent plasma obtained from the recovered COVID patients. We are trying to use this on the patients in the state of Goa, and I think actively we will be using it from this coming Monday, and
right,
we are already in the process of collection of plasma and for storage for basically to take this forward.
All right, Minister, we wish you all the best in that endeavor. But let me, come down to information that might actually interest a lot of people around the country, who would, of course, be hoping that they would be able to spend these lockdown months in Goa. I, for one, wish I was in Goa during this lockdown. But it's very interesting because there's a mandatory COVID test for anyone who lands in Goa. That's if you don't already have a COVID negative certificate. What's the rationale behind doing this?
No, basically, what we said is there would be a validity of about 48 hours for the COVID test that you take if you fly into Goa. But in addition to that, in case a person doesn't have a COVID test done from the destination he's coming into Goa, then we offer him to do a test as soon as he comes to Goa for a particular price that has been quoted, which is there in our standard operating procedure. And we ensure that within 24 hours, the report is given to the person who comes into the state. Till then, we identify the place that he's going and ensure that the administration ensures that he is in the respective place and in quarantine till the report comes. The reason is that we want to see that along with the tourism and opening up tourism, that this COVID-19 is restricted and we don't have people coming with COVID-19 into the state of Goa and moving around freely and then creating another situation where again it becomes difficult to trace back as to where the person has traveled and moved. So this is the way I think with the type of procedures and SOPs that the government of Goa has got, this is the right way in order if you want to parallelly open tourism and move on parallelly along with COVID-19 in the state of Goa. But our procedures and our SOPs are much stringent and stronger than any other state in the country. You just mentioned actually on the news that Maharashtra is also opening guest houses and hotels after a long period of time.
Yes.
That way, Goa, if you look at the situation in Bombay, it's very horrifying.
Right.
But if you look at Goa, we are much more well controlled. We got a chief minister who's pretty proactive, and overall, our ministers, MLAs, and we have taken everybody into confidence, including our colleagues in district administration, local body members, and we are trying to see how best we can keep Goa safe and have people coming into Goa, test them, so that, we feel that the people of Goa are also safe and people also coming into Goa know that they do not have any kind of anything related to COVID and can move around freely in the state of Goa following the standard operating procedures.
All right. Also, what if somebody tests positive after they've landed? Is it mandatory institutional quarantine? Is it home quarantine? Many of these people would actually be living in hotels or homestays. So what's the protocol that kicks in then?
No, once you're detected positive, then it is institutional quarantine.
Okay.
And that is for sure that we need to do because we have been following this procedure and process. And there's a part of our standard operating procedure. If a person is detected positive, we have not yet taken a decision whether he should be in home quarantine. You generally put him in institutional quarantine till he recovers and is tested negative.
All right. Very last question before we let you go. You're also Industries, Trade and Commerce Minister. How difficult has this lockdown period been for a state like Goa where you're predominantly dependent on tourism as a primary source of income?
It has been a very difficult task, Ishita, and overall, if you go to see people also, we are talking about opening of tourism. We are trying to create the best practices that are available so that we can keep Goa safe and people also feel safe who come into the state of Goa. It has been a very challenging time because most of the hotels, restaurants, everything has been shut. Even to reopen this, and migratory labor also has gone back to its own town. Their villages and maybe coming from UP, Bihar and other neighboring areas and neighboring states. So basically, it's a challenge even for hotels to open because, your standard operating costs remain the same. So basically, we are asking the hotels to open. I'm just assuming opening, they need to have at least 50% occupancy even to break even, which is a challenge in today's time.
Yes.
I think it's a big challenge, and to take it forward in this way, at least we have to make a beginning, as a result of which we thought that we need to ensure that if we have stringent procedures and guidelines in place, and we are also enforcing, we have put stringent fines as far as people who roam without masks and wherever
Right.
their social distancing is not maintained. So, basically you doing all this, the mindset of the people also we are changing. But like you said, as an industries minister, it has been a great challenge. Only industry that has been doing extremely well is the pharma industry and pharmaceutical industry.
Right.
We are trying our best to support industry in state protocols and trying to encourage industry, whatever they need to do, following social distancing and other norms that are required. But to a great extent, we have achieved success, and we feel that this type of support and little extra, hand-holding the industry in today's time is the need of the hour.
All right. Thank you so much, Vishwajit Rane, for joining us on the broadcast. The Goa Health Minister there talking about the COVID-19 situation in Goa and how there are some stringent rules and regulations that are in place, but Goa has opened up to anyone who wishes to take a break and visit. Thanks so much for sparing the time.
Thank you, Ishita. Thank you so much.